Conjunctivitis, commonly known as pink eye, is inflammation of the thin tissue covering the white part of the eye and inner eyelids. It can result from infections, allergies, or irritants, leading to symptoms like redness, itching, and discharge. This guide offers solutions to manage conjunctivitis effectively, promoting comfort and recovery. Here are the 14 solutions for conjunctivitis, or pink eyes. Number 1. Warm compresses. Apply warm compresses to your eyes several times a day to relieve discomfort and reduce inflammation. Number 2. Cleanliness. Maintain good hygiene by washing your hands frequently, avoiding touching your eyes, and regularly cleaning surfaces like towels and pillowcases. Number 3. Artificial tears. Use preservative-free artificial tear drops to soothe irritation and flush out irritants or allergens from your eyes. Number 4. Antihistamines. If your conjunctivitis is due to allergies, take over-the-counter oral antihistamines or use antihistamine eye drops to alleviate symptoms. Number 5. Antibiotic treatment. If your conjunctivitis is bacterial, your doctor may prescribe antibiotic eye drops or ointment to clear the infection. Number 6. Avoid contact lenses. Refrain from wearing contact lenses until your symptoms improve to prevent further irritation and potential complications. Number 7. Stay home. If your conjunctivitis is contagious, such as viral or bacterial conjunctivitis, stay home from work, school, or other public places to prevent spreading the infection. Number 8. Cool compresses. In cases of allergic conjunctivitis, cool compresses can help reduce itching and inflammation. Number 9. Avoid allergens. Identify and avoid allergens that trigger your conjunctivitis symptoms, such as pollen, dust, or pet dander. Number 10. Eye protection. Wear sunglasses or protective eyewear outdoors to shield your eyes from irritants and UV rays. Number 11. Environmental control. Keep indoor environments clean and well ventilated to minimize exposure to allergens and pollutants. Number 12. Proper disposal. Dispose of tissues, cotton balls, or other materials used to clean your eyes properly to prevent contamination and spread of infection. Number 13. Stay hydrated. Drink plenty of water to maintain overall hydration, which can help alleviate dryness and discomfort associated with conjunctivitis. Number 14. Follow-up. Attend follow-up appointments with your healthcare provider as scheduled to monitor your progress and adjust treatment if necessary. Remember, these solutions are general recommendations, and it's important to consult with a healthcare professional for personalized advice and treatment tailored to your specific condition.